Thank you, Carmen. Senator Feinstein's, I would say, thoughtful indignation about the behavior of health insurance companies in California is a reflection of the feelings of millions of Californians who have, in the last year and a half, since the passage of federal health care reform, been subjected to astounding increases in their premiums. Sometimes every few months, another notice goes out. And so it's very appropriate for the purposes of our discussion today to note that the title of the Consumer Watchdog report, health reform and insurance regulation, you cannot have one without the other. Because California is because of its initiative process, California is often considered to be a laboratory for democracy, and ideas that are tested there can often become the models for reform efforts around the country. That happened with property taxes, it happened with term limits, and I'm here today to talk about when it happened in 1988, when there was a voter revolt against high auto and home insurance rates in California. And as I relate the history, I'll make some pointed comments or ask you to make the connections between what happened in California in the 1980s and what's happening around the country today. That first connection is this. Back in 1984, the state legislature passed a law mandating that all motorists in California purchase auto insurance from private insurance companies. That was the mandate to purchase auto insurance in the state of California back in 1984. And guess what? By 1986, insurance premiums were skyrocketing. The insurance companies took advantage of a captive market of millions of Californians who had to purchase insurance in order to legally drive, and auto insurance rates went through the roof. Followed soon after by home insurance, apartment insurance, and business insurance premiums. Now, the insurance industry claimed, as they always do, that the reason why they were raising rates was because there were too many lawyers and too many lawsuits. But a little investigation uncovered the fact that that just was not the case. And in fact, tort reform had been imposed in California, some of you may know this, for medical malpractice insurance in the 1970s. Damage awards were capped, attorney's fees were capped for victims of medical negligence. And the promised insurance savings for doctors who paid those malpractice premiums not only never materialized, their premiums went up another 450% from when those malpractice caps were passed in the 1970s through the mid-1980s. So it became clear that the real problem was that California was the only major state in the nation where there was no regulation of insurance companies' rates or practices. And so we took the issue to the ballot box. The legislature had an opportunity to make some very modest reforms. The industry, as it always does, opposed those reforms, and so thankfully in California we can take advantage of the access to the ballot, and that's what we did. Here's what Proposition 103 required: an immediate 20% rollback of rates to November 1987 levels. So think about what happened with the Accountable Care Act here in Congress. There was no recognition that perhaps the insurance companies in advance of 2014 would attempt to raise premiums or engage in other subterfuges or dodges. We understood what the insurance companies would do once we put Prop 103 on the ballot. So there was a rollback to November 1987, 1 year earlier, and then all rates had to be reduced a further 20% after that. From that point on, Proposition 103 required prior approval of insurance rate increases or decreases. In other words, the companies would be required to file an application to change their premiums. That application would be subject to public scrutiny as well as review by the insurance commissioner, and the commissioner would say yea or nay on those if the application did not comport with the formula that the commissioner was required to provide to determine whether profits or expenses or projections of future losses were excessive. Those rates could be rejected. And perhaps most importantly, at least for the purposes of Consumer Watchdog and what we've done in the last 20 years, Prop 103 gave any citizen the right to challenge a rate increase or decrease request, file a petition, and seek a hearing. And in certain circumstances, those hearings must be granted by the insurance commissioner. The right to go into the Department of Insurance and challenge rates and then be paid for it. In other words, fees for the actuaries, for the lawyers, and expenses of the experts that you need to go toe-to-toe with insurance industry lawyers and actuaries are paid for by the insurance companies, so that the public, the consumers, are put in an equal footing with the insurance industry's lawyers. That was a critical provision of Prop 103, and I'll explain why in a minute. 103 also applied the state's antitrust and civil rights laws to the insurance industry for the first time, and it prohibited some other underwriting practices that were widely reviled in the auto insurance market in particular. Insurance companies threatened to leave California. That'll be familiar to some of us here today. If they told the voters, if you have the temerity to pass Prop 103, we are going to leave the state. Well, they spent $60 million trying to defeat Proposition 103, but people were so angry that they passed it, notwithstanding the money and the threats. The day after the initiative passed, Aetna announced that it was going to leave the state of California. And then it turned around and looked back, and none of the other companies were following. So we kind of crept back in very quietly. They never actually took the buildings and left. They're still there today. Now, what has Prop 103 done in the intervening years since it was passed in November 1988? Well, first of all, $1.2 billion in refund checks were issued by insurance companies pursuant to the rate rollback and refund provision. I've been in congressional and legislative hearings around the country where insurance industry advocates claim that either Prop 103 didn't pass or no rollback checks were issued. But let me assure you they were. According to the Consumer Federation of America, in a 2008 report, Prop 103 had saved California motorists $61 billion during the intervening years. Now, Prop 103 applied to not only auto but home and business, $61 billion in savings just for auto insurance. We used to have the third highest premium in the nation by 2008 for auto insurance. It was 20th. And whereas, and I think some of you have seen this chart that we prepared, it shows two lines, one going nuts up in the air, one kind of flat. Whereas rates in California, nationwide, the average liability insurance premium expenditure by consumers went up 43% nationwide between 1989 and 2008. In California, it went up about 4%. That's the effect of Proposition 103. Consumer Watchdog has intervened to challenge quite a number of rate increases over the last few years, and in the last 7 years alone, using that intervener process that I described, we have saved Californians $2 billion. We have blocked $2 billion worth of rate increases. Now, I'm often asked, well, Harvey, why didn't you make Prop 103 apply to health insurance? Well, back in that day, health insurance was not industrialized. It had not been privatized. The ethics and structure of the industry was pretty much a nonprofit industry devoted to protecting the health of patients. And as we all know, that changed it began to change in the 90s when the Clinton healthcare plan failed. HMOs swooped in to privatize the system and filled the vacuum created by the failure of Clinton Care in 1994. And it wasn't really until the mid-1990s that you started to see the results of for-profit medicine. You'll remember so-called drive-by deliveries where your wife would go in to have a child, and the hospital would try to boot her out with the kid in 24 hours. Some of those reforms were, some of those abusive practices were changed ultimately, but when I wrote Prop 103, health insurance was not the problem it is in California today. Let me just say one more thing about, make one more analogy that is applicable to the Accountable Care Act and the political environment we're in now. Back during the Prop 103 campaign, insurance companies claimed that Prop 103 didn't do anything about the underlying costs of insurance. In this case, they would say, well, it's not going to stop car accidents. How can regulating insurance companies' profits and expenses, limit the number of claims or deal with the cost of banging out a dented fender? In fact, Prop 103 did, and here's how. It turns out that when you have a cost-plus system, as insurance was in California prior to Prop 103, the companies would just spend whatever they had to pay claims. They didn't care about fraud. They didn't care about waste or inefficiency. They just paid the claims, and actually the more they paid, the bigger the markup they were able to put on it because the premiums were unregulated. Once Prop 103 passed, the formula went into effect that limits their profits and expenses and overhead and projections of future losses and so on. The companies, for the first time, got serious about cracking down on fraud. And you've seen, even here in Washington, D.C., you saw the creation of, by the industry, of the Institute for, I think it's called Highway Safety, where the focus is on a loss prevention. When it was a cost-plus pass-through system, like healthcare is today, there was no incentive for insurance companies to worry about the underlying costs. So regulation of auto insurance not only reduced premiums by wringing out profiteering and gouging, it also gave insurance companies an incentive to do this, to do the kind of efficiency, belt tightening efficiency steps that were needed, and that has allowed insurance companies in California in the property casualty industry to still earn a healthy profit every year, even though rates have been reduced and far below what they would have been. When you think about that in the context of today, the medical loss ratio that is in the Accountable Care Act actually perversely creates an incentive for insurance companies to spend more on what they call medical care, but as you all know, now within that definition, it may be taxes and other items that most of us wouldn't think of as having to do with medical care. But the fact is that in order to boost their 15 to 20% piece of the ratio for overhead and profit, all they have to do is boost spending. So there's a perverse incentive that only regulation of premiums can unwind. And I want to close with this thought for the insurance industry. If you look around what's happening in California, I can guarantee you that the same thing's happening all over the country. The same forces that swept in the strongest regulation of auto, home, and business insurance premiums in the nation in California in 1988 are gathering force right now. The industry never understood what was coming. They took advantage of their ability to use the campaign finance system to block reform in the halls of the legislature, but ultimately voters took matters into their own hands. And that's where this is heading in California, and at least in the other states in the nation, where there's an opportunity to go to the ballot box.